Okay, sorry, the internet is very unstable. Uh, Kindly bear with me. So, second thing is increase in the cardiovascular demand. So, as we know, the pregnancy itself will be increasing the demand on the cardiovascular system. It needs more of circulation, more of the blood flow, more of oxygen, and other thing. Plus, along with that, the exercise also will increase the demand. So, you need to keep this in mind. Sometimes, if a patient is a cardiac patient, then you should not give exercises for them, because if you give, then the demand will increase further, the heart may give away. So you need to be very careful when you are giving the exercises. Next is, after the first trimester, the supine lying position should be always avoided. Why? Because when she is lying in supine after 3 months, the uterus will be directly compressing the inferior vena cava. So this will lead to reduced blood venous return to the heart, and this will again affect the circulation. So you need to be very careful. You should avoid supine lying after first trimester. That means after 3 months. So next is, the women definitely need an extra calorie for the baby. So she should not only eat for herself, she has to eat for her baby also. So this increase, but anyways, it is a very small increase in the calorie. It is not too much, but along with that, you need to see that whenever she is doing exercises, she should be eating little more extra. Otherwise, it may lead to hypoglycemia, because normally the fetus will be just absorbing whatever is available. Okay, then it will be giving only very limited to the mother. So if the mother is not having enough calories, the fetus is not going to the one, will not suffer, but the mother only will be suffering, because the fetus will just take up whatever it needs. So if it needs some 500 calories, the total 500 calories the fetus will take up. So the remaining only will be available for the mother. So you need to be careful. Sometimes they may lead to hypoglycemia also. Okay, so this one also you have to keep in mind. Then thermoregulation. So normally, because of the pregnancy, the mother's body will increase little bit. That is, the maternal temperature will be little higher compared to the normal person. So when you are doing the exercises, further this maternal temperature may increase little more. But when the temperature is increasing, it will be affecting the fetal growth. Okay, it will be having a very bad effects on the fetus growth. So that's why you need to be very careful. So whenever you are doing exercises, you need to check the room temperature. If it is a very hot climate, then you have to avoid the exercises during that time. They are supposed to do the exercises either in the early morning or in the evenings. Okay, then only the temperature will not increase further. The next is demand in the respiratory system. So respiratory system, like heart, the respiratory system also will be in greater demand. So when you are exercising, the blood circulation and the increased need of oxygen and the calories will be going to the upper limb and lower limbs. So this may deprive the blood supply to the fetus. So this will lead to decrease in the growth of the fetus. So this also you have to keep in mind. So these are the maternal risks. But with all these risks, it doesn't mean that you should not give exercises. You have to give exercises, but you have to take a lot of precautions, that you check all these things while they are doing the exercises. Then the fetal risk is nothing but if the fetus is not getting proper blood supply, if the fetus is not getting proper oxygen, then it may go to distress. And sometimes if it is reduced drastically below than 50%, then definitely it may die. So you need to be very careful like that. Then another thing is, if continuously the fetal circulation is affected daily, then the growth and the development of the fetus will be reduced. So this also you have to keep in mind. Sometimes, like when the maternal core temperature increase during the first trimester, there is more possibilities of malformation, like anatomical malformation will be there if the maternal core temperature is higher in the first trimester. But it doesn't mean that second and third trimester is normal, not like that. you have to see to that the maternal core temperature doesn't increase further throughout the pregnancy. Then next is like, if in the third trimester if they are doing a lot of exercises, sometimes it may trigger the uterine contraction, and sometimes it may trigger the labor. So you need to be very careful. Do after 28 weeks and all, you have to little bit reduce the exercises, then slowly you can increase the exercises. Then so only during the 7th month you need to be careful to monitor the patient, then slowly again you can ask them to do the exercises. So these are the fetal risk during fetal risk due to exercises during pregnancy. Then contraindications. So we have absolute contraindication and relative contraindication. Absolute contraindication means where uh, you should not do the exercise at all. Relative contraindication means like you with precautions you will be able to do the exercises. Okay, so absolute contraindication means totally you have to avoid the exercises. Relative means like with precautions you will be able to do the exercises. So absolute means like in absolute you have cardiovascular problem, acute infection. So cardiovascular problem, if they do exercises, it may increase the demand and it may lead to some other problem. So you should not give exercises. Acute infection, if you do exercises because of increase in the circulation, the infection will be spreading out. So you should not give exercises. Then if the mother has history of miscarriages, if they have more miscarriages history, then don't give exercises. Then if they have more history of preterm labor, then also don't give exercises. And if they have a multiple pregnancy means more than one fetus in the uterus, so that is called multiple more than two is called as multiple pregnancy. So one is a single gestation, sometimes they will have twins, sometimes they will have triplets, then sometimes 4 5 like that. So recently I hope you would have heard, like I think yesterday or day before yesterday, one lady in South Africa has given birth to 10 children. So that like that it is called as multiple pregnancy. So for those kind of people you cannot give exercises because already they have a such a huge demand of oxygen and the blood supply. If they do exercise, then that's all, they will immediately go for miscarriage or deliver. So you should not give for multiple pregnancy. One and two is okay. More than three and more than that, you have to better avoid the exercises. Then if they have any vaginal bleeding, some people will have the rupture, like we know that the rupture of the mucoid plug will be happening before the labor, but some people will have the rupture earlier itself, and some people will have spotting. So for these people you should better avoid doing exercises. Then incompetent cervix means the cervix is not fit enough to close the uterus properly, then also you should not do exercises because it may induce the pregnancy. Then pregnancy induced hypertension. Some people will have pregnancy induced hypertension. That means normally their blood pressure will be in the inside the normal limit. But because of the pregnancy, they may have the increase in the blood pressure. So those people you should avoid exercises. Then if you suspect IUGR means intrauterine growth retardation. That is called as IUGR. Okay, intrauterine growth retardation. So for those people, again you should not do exercises because already the baby's growth is very less. Further, if you reduce the blood supply, then further the growth will be affected. Then thrombophlebitis and pulmonary embolism. So if you have pulmonary embolism, you should not do any exercise because further it may lead to, it will go and it will block the heart, or it will go and it will block the lungs or brain. So you should avoid exercises. Then chronic hypertension, active thyroid disease, then like any vascular disease, pulmonary disease and all, you should not give exercises. Then uncontrolled diabetes, also you should not give any exercises. Okay, so these are the absolute contraindications. So in relative contraindications, you need to take precautions if the mother is not used for a high level of exertion. That means if the women is used for a very sedentary lifestyle and she is not used for increase in the any physical fitness, increase in the physical activity, then you should be very careful. You should not uh, give more exercises. With precautions you can give them exercises. If the mother has any blood disorders like sickle cell anemia, so sickle cell disease means they will have reduced hemoglobin. So the hemoglobin is the particle present in the blood that will be carrying the oxygen to the carrying the oxygen to all the parts of the body. If the hemoglobin level is reduced, then the transportation of oxygen will be affected. So you need to be very careful. Okay, anemia also same thing. Then thyroid disease, diabetes, all these and all, like with full precautions you will be able to give them the exercises. If they are extreme obese or underweight, then you need to be careful. Then same thing like breech presentation also, you need to be very careful during the third trimester. Okay, and these are some of the guidelines you need to follow before giving exercises. First thing is you have to avoid any jerky or bouncing movements. That means you have to avoid all the jumping movements. So if they do jumping movements, what will happen? It will be triggering the lower abdomen and it will trigger the uterus, and they may lead to immediate labor or they may lead to miscarriage. So you have to avoid all this bouncing, jerking and ballistic movements. Then regularly you should do mild to moderate exercise alone. It should not be more than, like, you should not go to a high intensity exercises. So I hope you would have learnt in your aerobic exercises. So mild to moderate exercise session only you have to give. You should not go for a high intermittent exercises. So mild to moderate means it should be between 12 to 15 Bogue scale. Okay, so it should be between 12 to 15 in the Bogue scale. So in that only you have to give. You should not go for high intensity. Then give a good warm up session and cool down session. Okay, so warm up session can be a flexibility exercise and a stretching exercise, but don't give ballistic stretching because already the joints and the ligaments will be loose. So if you are going for a ballistic stretching, further it will elongate the joint and the joint will be totally unstable. So you need to avoid ballistic stretching. Then avoid exercises in the humid climate because we know that during hot climate the temperature will increase and the core maternal temperature will be increased and it may affect the baby. So you need to be very careful. Then maternal heart rate should not exceed 140 beats per minute. So vigorous exercise should not be continuously, you should not do for more than 15 minutes. So okay, so you need to check the heart rate, you need to check the duration of exercises. Then you need to check the Bogue scale whether they are within the normal limit. So if they do higher than that, you have to ask them to stop it. Then during and before and after the exercise they should drink proper water because sometimes it will lead to dehydration. So you need to ask them to drink a lot of fluids during and after the exercises. Then if they are a sedentary lifestyle people, then go with a low intensity exercises. Don't go with a moderate intensity exercises. If they are sedentary lifestyle, go with a very low intensity exercises. Then during the aerobic component you have to you can give them walking, cycling and aerobic dancing, but you need to see whether they are eligible for aerobic dancing or not. So people who are obese, people who are having more flexibility, you should avoid aerobic dancing. Okay, so avoid supine lying after first trimester, avoid standing motionless for long time. So avoid giving competitive elements. So they should not get they should not be like doing the exercises with the competition with the nearby person. So this exercises they are doing for their self, so they should not do any competitive kind of elements. So they should not think that they should do better than the nearby person and they should not do all the exercises. Okay, then definitely they have to be in between 12 to 14 in the Bogue test. So Bogue test, I hope you know. So this 12 to 14 is hard to somewhat hard. So during that hard to some, how to find out whether they are doing between hard to somewhat hard, they should be able to answer your questions. So while doing, they should not get any breathlessness and they should be able to answer you. So if they are able to answer, then it is between 12 to 14. Okay, hard to somewhat hard. So then, like, you have to follow the signs and symptoms. That is like whatever when they are doing the exercises, you have to keep on observing them whether they have any signs and symptoms of any cardiac problem or any vascular problem. All those things you have to keep checking. Otherwise, sometimes it will lead to they will be doing more exercises and it will lead to some other complications like cardiac problem or respiratory arrest and other thing. Swimming is the best exercises for pregnant women. So if because the buoyancy will help them to support the patient's body weight, mother's body weight, and it is a very good, excellent toning up and strengthening exercises. Okay, so if the mother doesn't have any fear of water, then you can go for swimming or water exercises. This will be giving them a good relief. Okay, at the same time, this will help them to reduce the edema also. Normally, they will be having edema in the upper limb and the lower limb. So, you can also reduce the edema. So, it is very effective. Then during swimming, you should always avoid breaststroking. So breaststroking is nothing but stroking use while you are swimming. They will be using hip abduction because hip abduction will increase the symphysis pubis dysfunction. So normally, this pregnant women will have little bit increased movement in the symphysis pubis joint. So when they do this breaststroking, it will again further aggravate and it will end up in mall union or it will be end up in mall alignment. So you need to be you need to advise them not to go for breaststroking. Okay. So, other than that, if the women doesn't know swimming, they can go for a warm up and cool down exercises in the water, and they can also do some exercises inside the water that will give them a good stretching and strengthening exercises. Next, regarding the diet, so definitely the mother needs little extra calorie other than the normal, and this extra calories is only 300 calories per day. It is not too much. So if they eat too much, then sometimes it will lead to more increase in the body weight, and sometimes it will lead to some problem with the baby. So they throughout the pregnancy they have to see to that they are having only 300 calories extra daily, and they are supposed to take nutritional food because the baby will be taking lot of minerals and the vitamins. So if they don't have the proper minerals and the vitamin, the mother will be lacking feeling deficiency in the minerals and the vitamins. And not only that, the baby also sometimes will be lacking those vitamins and they will end up in some other problem. So they should take up a nutritional well balanced diet throughout their pregnancy, and normal weight gain is around 11 to 15 kgs. So not, that means like per month they have to increase only 1 kgs, not more than that. Okay, some of the nutritions they are supposed to take will be like folic acid, so which is very very important because the folic acid will help to prevent neural tube defects such as spina bifida. Okay, so most of the time the doctors will give the folic acid to them, and they will be taking additional folic acid folic tablets. Okay, so that is very very important. If they don't take proper folic acid, then they will the baby will be lacking in ending up in spina bifida, or the baby will be lacking in vitamin B12 deficiency. So that will have serious complications in the baby. So they need to take up. So routinely they need to have at least zero point 0.4 mg per day before conception and during the first trimester. Later on, they may need little more. So this folic acid is present in vegetables like cauliflower, peas, and tomatoes, and in fruits like oranges, cereals, and yeast also will have this folic acid. Okay, so if the mother is taking lot of cauliflowers and lot of frozen peas, then they can avoid the daily supplements of folic acid. But again, it depends on the doctor. Most of the time, they will be giving this folic acid. Okay, then next is calcium. So calcium is very much needed for the bone, teeth, and the gum formation. If they don't take up proper calcium, then the baby's bones will be very weak and they may end up in rickets. So this calcium is mainly present in daily products, sardines and dry fruits. So not only that, nowadays like the people will be taking a lot of calcium supplements, but they don't go out in sun. Okay, but vitamin D is essential for absorbing this calcium. That means if you take calcium, you need to have vitamin D, then only the calcium will be absorbed. Otherwise it will be just excreted in the urine. Okay, so if the you have to advise the mothers to go for a walk either in the early morning or in the in a little bit of dawn climate, they have to go for walking. They have to get this sunlight which is very richly having vitamin D. Okay, so when they are going for a walk to get vitamin D, they should not put lot of sunscreen and go. If they take apply lot of sunscreen and walk in the sun, no use at all the vitamin D's will be reflected back. They will not be absorbed. So you need to advise all these things when for the mother. The next thing is they should have omega 3 fatty acids. This omega 3 fatty acids is very essential for the baby's brain and neural development. Okay, so this is very important. So if the baby if the this omega 3 fatty acids are present in fish oils, and it is lot is present in the fish. Okay, so if people who don't like fish, then they can go and have fish oil. Okay, then next is iron. So iron is the main thing. Like folic acid, without iron then the baby will have lot of other problems. So this iron they need very in a very higher level. So they need to have definitely they need to take up lot of supplement with the iron. Then not only that, this iron is present in red meat, beans, nuts, green vegetables. All the greeny vegetables will have richly rich in iron. Okay, like broccoli. Broccoli has a very high rich in iron and calcium. Okay, so that is very important. And all the leafy vegetables or like spinaches, everything has a very good amount of iron. So that one they have to definitely take. So for good absorption, they can eat with vitamin C and avoid combining with caffeine. So if they take iron supplement and immediately if they drink coffee or if they drink milk, then the iron will not be getting absorbed. So they need to take iron along with vitamin C, or they should not take any caffeine, or they should not take any milk during that time. It's not that the whole day, during that time. Then the women have to have a good fibers, because during pregnancy, because of the looseness of the muscles and the ligaments and other thing, because of the smooth muscles will undergo dilatation. All this will lead to constipation for the mother. So to avoid this constipation, they have to go for they have to have a rich fiber content food. So rich fiber content food is available in the dals, and will be available in the dal. And they can also take up they also have to take up they also have to take up this that means when they are eating fruits, like if they are eating uh, apple, orange, another thing, they have to eat along with the outer skin. They should not take only the pulp. If they are taking only the pulp, then it may reduce the fiber content. So they should take it along with the pulp. So that is very important. Not only that, and they have to also drink a lot of fluids. So this also will help them to reduce the constipation, which is very very common during pregnancy. Yeah. Then so diet is very important for the pregnant mother. Then you have to see to that during the first trimester the mother will be having lot of vomiting and other thing. So even if she is taking up lot of healthy foods, because of vomiting and other things she may lose the needed minerals and vitamins. So you need to see to that, and see to that, and since you have to advise them to take care of it and properly supplement if they have more vomiting. Okay, there are some of the foods definitely they have to avoid. First thing is they should have to take up a very hygienic food. So it's better to prepare the food and eat it rather than getting from outside, like getting from outside and other parcels and other thing. So they have to avoid all the junk foods because already the mother's immunity will be little bit less during pregnancy. If they have a unhygienic food, it may affect their immunity and they may end up in some infection. Okay, then they have to avoid the salmonella fish. So this fish may cause some food poisoning and they may end up in a lot of problem to the, especially to the fetus. So they have to avoid this. And this sometimes like raw eggs also will be causing them problem. So sometimes like uncooked poultry, uncooked non-veg foods and all will be having lot of problems. So they have to cook the food completely, thoroughly, properly, then only they have to eat. Then they have to avoid all the raw things like mayonnaise or mouses or lot of things like cheesecakes. So all these things will have some raw products, so that one they have to avoid. Then they have to avoid liver, because liver will have excessive uh, iron. So this excessive amount of vitamin A may cause some problem to the baby. So they have to avoid this excessive liver, which may end up in spina bifida or any other problem like that. Okay, so they have to avoid those. Next is they have to avoid dark fish like shark, tuna. All those fishes will have very high level of mercury. So this high level of mercury will be affecting the fetus, especially it will be affecting the neural development. So you need to avoid all this dark fishes. Then peanuts, some people will have allergic to peanuts. So those people have to avoid the peanuts during pregnancy. Then next is caffeine. So caffeine can be taken to a limit. So daily they can take around 300 mg of caffeine, not more than that. So this caffeine is present in tea, coffee, carbonated drinks, then chocolates. So they sometimes increased caffeines will lead to miscarriages. So you need to be very very careful regarding this. So you have to advise them, definitely they should not take more caffeine during pregnancy. Then alcohol is a strict no, no, because alcohol will affect. Okay, so drinking alcohol will be affecting the central nervous system of the mother, and they will not know what they are doing, and they may slip, they may fall down. A lot of other problems will be there. So that's why strictly they should avoid alcohol. Smoking will definitely affect the baby as well as the lungs of the mother. So they have to avoid smoking. Then taking medications, they have to strictly check with the doctors whether they can take some medications, because some medications will be affecting the fetus and some medications will lead to miscarriages also. So when they are taking any medications, they have to check with the doctors whether they can take the medications, then only they have to take the medicines. Okay, so this is about the diets which they have to avoid it. So as a PT, we have to know that, because when a mother is coming and asking you, you are supposed to answer them. You cannot say, just say that I don't know about that, and you cannot say that you please go and check any nutritions, or even though the nutritions will be there in your team, but still you should know all these details. Okay, you may not need to go and give them the diet counseling, but when they come and ask you, you are supposed to know it. Is that clear? Okay. So I'll give you some 10 minutes break, then we will go to the practical aspects of the antenatal class. Is that clear? Okay. So now
Yes,
the time is 2:50. So we will meet by 3 o'clock. Is it okay? So can we start?
yes, miss.
Sometimes the practical aspects will be a little bit overlapping. Okay. So in this class, we will see how to assess a pregnant mother. Means how to do a assessment on a pregnant mother. Then what are the contraindications and how to demonstrate the antenatal exercises. So this one we have already seen the guidelines for women's during exercises. Along with those guidelines, additional points are like you should never give any stressful exercises in the first trimester. So that means like even though if you are conducting exercises in a group, but still you need to be very careful in such a way that you should never do you have to keep watching the mother whether any exercises is a little bit stressful to them. So you have to keep watching, you have to keep checking their book scale. So that's very very important. Okay, then that is first thing. Then next is you can introduce the Swiss ball, because the Swiss ball will help them to strengthen the core muscles, which is very very important, as well as which will be giving them a good fitness during the pregnancy and after the pregnancy. So you can introduce the Swiss ball to them. Then avoid overstretching and passive stretching. They can do a manual stretching by themselves, that is self stretching by themselves. Then avoid single leg weight bearing, because already the mother will be little bit overweight. Okay, and because of the changes in the center of gravity and other thing, their posture also will be different, and the joints also will be little bit lax, especially the pelvic joints, which will not have any movement, but during pregnancy it will be little bit loose and it will be lax. So that when they are standing in single leg, the complete weight will be going through one leg, and it will lead to symphysis pubis dysfunction, or it will also sometimes it will lead to SA joint strain. Okay, so you have to ask them to avoid any single leg weight bearing. Then whenever they are moving, they are changing the position, they need to do it very slowly, especially when they are coming up from lying to standing. They need to do it very slowly, because they may have postural hypotension, orthostatic hypotension, because suddenly if they get up from lying, the already the blood pressure will be little less, and because of the dilatation in the blood vessels, the blood will fastly it will move to the lower limb. So at that time they may have the giddiness, so you have to make sure that they are getting up very slowly from lying to standing position. Then avoid Valsover maneuver. So Valsover maneuver is nothing but breath holding technique. So when they do a breath holding technique, it will be the diaphragm will go down and it will be compressing the inferior vena cava. So this will lead to reduced venous return, and this will lead to reduced cardiac output. Okay, so they have to avoid this Valsover maneuver. Then the core temperature should always be below 38 degrees. So the normal human temperature is 37 degrees, and there will be definitely increase in 1 degree Celsius during a pregnancy, and it should not go more than 36 degrees Celsius. And do not do any multiple joint stretching. Okay, so don't do any multiple joint stretching. Do cross training. So cross training means like you can do exercises for upper limb, then you can go for lower limb. By the time then you can go for trunk. Then by the time you come back to upper limb, the upper limb will be would have taken rest. So do cross training. That is very good. Not only that, you can do some of aerobic exercises. Then you can do some anaerobic exercises. Then you can do again swimming, like that. So mix all the exercises and do the exercises. Then encourage the mother to empty the bladder before the exercises, because with the full bladder, if she does exercises, it will be keep on compressing the uterus. So they so encourage her to empty the bladder before the exercises. Then whenever you are doing any stretching, you need to take proper precautions. Do not do any overstretching. Okay, that is very very important. Then exercise should be done at least 3 times in a week. So then only it will increase the tone and the stamina. So 3 times in a week means it is always alternative days. So ask them to do alternative days. That is very very important. Okay, so these are the contraindications whichever we have seen already. Okay, so then what are the benefits of exercises? So first thing is the exercises will increase the well-being, sense of well-being. So when you do exercises, automatically you will feel unique freshness and unique sense of well-being. So that is very very important. So uh, the exercises will give that sense of well-being. Then it will reduce the leg cramps. So normally the pregnant mothers will have this leg cramps or calf twitching during the night. This is because of dehydration and lack of calcium and potassium. But when they do proper exercises, this will be reduced. Then this will help them to reduce the stress incontinence, which is very common during pregnancy. This will help them to reduce the musculoskeletal strains because of the postural deviation. They will be having a lot of pulling and pushing pain, so that will be reduced because of this exercises. Then this will help them, definitely help them to have a very easy labor and a shorter labor compared to compared to non exercising. Then this will definitely reinforce the relaxation techniques, which is very very mandatory for them, which is very essential during their labor. So this is very important to teach their relaxation technique. Then this will help them to prevent and treat the problems association to gestational diabetes, hypertension, and PCOS. So aerobic exercises, from mild to moderate aerobic exercises will help them to reduce this gestational diabetes, reduce the hypertension, and cure PCOS. So these are some of the benefits. Then apart from that, it will maintain the cardiovascular fitness. It will help them to improve the posture. It will help them to strengthen the weakened muscles, then stretch the tightened muscle. It will help them to improve the breath awareness so that they don't go for hyperventilation, and they will be able to maintain the normal uh, normal breathing technique. Okay, so that it improves circulation, it reduces stress and anxiety, it will increase endurance, stamina, then it will help in labor and postnatal recovery. So these are some of the benefits. So when you are making them, calling them for the first day of exercises, you have to explain all the benefits to them so that they continue the exercises. Okay, then we will go to the assessment. So assessment first is subjective assessment. So subjective assessment, you have to do, you have to check their name, age, weight, height, and BMI. So age is to rule out if they are pregnant for the first time after in 40 years or 45 years. Then you need to be very very careful while giving exercises. Okay, so for that only you are checking their age. Then weight and height to check their BMI, to check whether they are obese or normal weight. Then marital status, maybe not much needed for Malaysians, like for Asians, maybe needed for Europeans. Then occupation, so to rule out whether they have any occupational hazards, whether they need to change occupation or anything like that, or to teach the exercises according to their occupation. Then hobbies, also to teach the exercises according to their hobbies. Then consultation names and any chief complaints they have. So now you have to keep in mind, when you are dealing the patient in the during prenatal time, sometimes the patient may come to you with some chief complaints. Okay, sometimes the mother may come for a routine antenatal classes. Okay, so you have two ways. One is the patient, the mother will be coming to you with some problem and they may be referred to physiotherapy. In others, they may come to a routine antenatal class. So according to that, sometimes they may have the chief complaints. Okay, chief complaints like low back pain, radiating pain, swelling in the legs, all those things are some of the chief complaints. Then here history taking is very very important, because we will not be able to do much of objective assessment. So history taking, with the history taking only, you have to get lot of details. So first is present history. So in case if they have any chief complaint, what is the onset of the problem? Okay, so if they don't have any chief complaints, then just present history, like how during pregnancy, whether they had any discomforts or anything, something like that. Then personal history regarding their personal habits, personal hobbies, personal food intake, because you need to avoid constipation. So you need to ask about their food intake. You have to ask about their routine diet. You have to ask about their anorectal function. That is whether they are going for like whether they are passing motion daily, or it is like they are having any stress, or they need to uh, strain for defecating. All those things you have to get. So this is in the personal history. Then medical history, whether already they have any medical related problem, like high bp, cardiac problem, respiratory problem, diabetes, or any other problems they have. So whether they are taking medicine for it, whether the problems are under control. So all those things you have to check. The next is the obstructive history. So obstructive history normally it will be coming under G, P, A, and L. G stands for gravida. Gravida means number of conception. Okay, P for number of delivery, A for number of abortion, L for number of live births. Okay, so the G and P may not be equal. Is that clear? So I repeat again, G and P may not be equal, because G is number of conception. So they may be getting conceived, then suddenly they may had abortion, or they may had medically terminated. All those things are called as G. All those things will be included in G, that is gravida. P is number of deliveries. So number of deliveries will not include the abortion and other things. Okay. Then A is number of abortion, L is number of live births. So this P and L may not be equal. Is that clear? P and L may not be equal. They may have delivery, but they may have stillbirth. Stillbirth means the fetus will be dead inside the uterus itself. Okay, but still they will be having a delivery. Okay, they may have a delivery and immediately the baby may die. So that's why P and L will not be equal. Is that clear? But when you count A and L, it will be equal to G. A and L will be equal to G. Okay. So this is about the obstructive history. This one you have to get it. Then type of delivery. So if they had already delivery, whether they had a normal delivery or a cesarean section. So that one you have to check. Then gynecological history. Gynecological history means their menstrual cycle, whether they had normal menstrual cycle or irregular, whether they have a normal cycle of 28 days to 30 days, or any prolonged cycle, whether they had any hormonal problem, whether they had any PCOS problem. All those will come under the gynecological history. Then surgical history. So surgical history is hmm, uh, surgical history is whether they had undergone any surgery, maybe related to pregnancy or non related to pregnancy, especially if they have undergone any abdominal history, abdominal surgical surgery, then you have to include that. Okay, then previous management for the problems they had. So it can be a medical problem, it can be a medical treatment, it can be a surgical treatment, physio treatment, diet, acupressure, or any other treatment they had already undergone for the present problem. Okay. So these are the things you will be getting from the patient. Then some of the things you will be getting from the case sheet, like BMI, blood pressure, urine analysis result, blood test results, whether the mother has edema, fetal movement, fetal movement especially after 8 weeks, whether they have a normal fetal movement of almost 10 movements in a day. sorry, in a in 10 in okay, in 12 hours they should have 10 movements. Okay, so that is a normal fetal movement. So what is the normal, whether they have the normal fetal movement, whether the fetal heart rate is normal, so whether the fundus height is normal, because if the fundus height is less, that means it indicates intrauterine growth retardation. So you have to check whether the fundus height is normal or correct. Then what is the screening results of the screening already done. So these are the things you will be doing in the, you will be getting in the case sheet. Then the in the objective assessment you have to do partial assessment, muscle power assessment, range of motion assessment, then sensation assessment. So partial assessment is the main thing you have to perform. You have to do a anterior analysis, posterior analysis, and the lateral analysis. Okay. Then in lying, in sitting, and in standing, you have to do the partial examination. Then muscle power, you have some of the common muscles that will be affected. So you can perform those MMT and check the muscle power. Same like that, commonly some of the joints will be affected. So that range of motion you have to do. So this and all like a general assessment. Then you, on observation, you can just see what and all is affected, and according to that, you can go for the objective assessment. Then sensation also you can check as a general thing. Okay, so these are the objective assessment you have to perform. Then the common problems the mother will be having is, one is pain, maybe low back pain or knee pain or neck pain or thoracic pain or any other pain. Then swelling in the ankles or swelling in the upper lip. Then if they have swelling, you have to check whether it is pitting edema or non-pitting edema. So if it is non-pitting edema, then you have to, sorry, if it is a pitting edema, then you have to grade. What is the grade for the swelling? Then whether they have any, like sometimes they will be having stiffness, sometimes they will have muscle power, reduced muscle power. Okay. So regarding the posture, if you see, the basic change in the posture occurs because of the distension of the abdomen. So the slowly the abdomen will become bigger and bigger. This will be pulling the center of gravity towards anterior, and this will change the line of gravity, and that will change the posture. So you can see this is when the mother is 14 weeks. Then slowly as the abdomen is becoming bigger and bigger, you can see the change in size, change in the line of gravity. So you can see here. So this is the normal line of gravity that is present in the mother. This is the change in the line of gravity. So they will be going for anterior pelvic tilt because of the distension of the abdomen. So you can see clearly here. Okay, so this is the change in the line of gravity. Because of the change in the line of gravity, they will be having anterior tilt, and they will be having uh, increase in the lordosis and increase in the kyphosis. Okay, so you can see here there will be increase in the lordosis and increase in the, because of the increase in the lordosis, automatically they will have increase in the kyphosis. And because of this postural change, some of the muscle will become weak, some of the muscle will become tight. So if you see the that is like the abdominal muscle will undergo weakness. Okay, then that means the opposite muscle group will undergo tightness. Is that clear? So when they have increase in the lordosis, the posterior muscle group will undergo tightness and the anterior muscle group will undergo weakness. Same thing when they have a increase in the kyphosis, the inside muscle will undergo tightness, that is the anterior muscle will undergo tightness, your pectoralis major and minor will undergo tightness, and the opposite, that the scapula muscles will undergo weakness. Okay, so like this, like these are the common muscles that are affected. So you have to check the MMT of these muscles, and accordingly you have to give them the training. Is that clear? So we'll just see because of the how the COG is changes with a video.
woman is pregnant, her pelvis begins to tip. When a woman is pregnant, her pelvis begins to tip backwards as the baby develops to balance the forward weight of the expanding uterus. As the pubic and tailbones move backward, the arch in the lower back increases. As the lower back arch increases, so does the curve in the upper back or thorax. The shoulders and head move forward and the chest collapses to balance the changing weight. All these changes can increase stress on the spine, exaggerating its natural S shape. Other muscles and ligaments can also be strained.
I repeat the video.
When a woman is pregnant, her pelvis begins to tip backwards as the baby develops to balance the forward weight of the expanding uterus. As the pubic and tailbones move backward, the arch in the lower back increases. As the lower back arch increases, so does the curve in the upper back or thorax. The shoulders and head move forward and the chest collapses to balance the changing weight. All these changes can increase stress on the spine, exaggerating its natural S shape. Other muscles and ligaments can also be strained.
So you can see the change in the line of gravity. So the muscles which are, so abdominal muscles will become weak. The spinal lumbar extensors will become tight. So here if you see, the pectoralis major and minor will become tight, and scapular muscles will become weak. Okay. Same wise in the leg, if you see, the hamstrings will become tight and the pelvic flexors will become weak. So this is a common muscles that are affected. So when you are giving treatment, you need to see, you need to check the muscle power of these muscles so that you will be able to give them the proper strengthening. Okay. Then, so because of the change in the posture, automatically the gait also will be changing. So the gait, they will be doing a pantham vandal gait, like a broad base of support gait. They will be walking in a very broader base of support gait. Okay, so first thing, if you see, the why they have a broader base of support is to balance the line of gravity inside the support area, base of support. So that's why they go for a broader base of support. Then the external foot will be going for increase in the angle. Okay, the pelvic obliquity will be increasing, the pelvic rotation, then the hyperextension of knee, then foot will go for pronation. So all this will be increasing compared to normal. And why it is increasing? Again, this is because of the posture, and because the joints and the ligaments are not able to hold the joint in a proper position, because they are already loose. Then, so these are the common weaker muscles. The neck flexors will be weak. The scapular retractors and depressors will be weak. The shoulder external rotators will be weak. Abdomens will be weak. Then pelvic floor muscles will be weak. Hip extensors and abductors will be weak. Ankle plantar flexors will be weak. So tighten muscle is, in the pelvis it will undergo, the hamstrings will undergo looseness, and the pelvic flexors will undergo tightness. Okay? That is because of anterior pelvic tilt. So these are the common muscles that will undergo tightness. So all these things as a PT you should know already. Then you can check this particular muscles alone how it is. Okay, and it doesn't mean that for all the people it will be like this. For some people it will be having tightness. Some people may not have the tightness also. So you cannot just generalize So if a pregnant mother means these are the things that will be there, so you cannot generalizely do the assessment. So you give a extra care to check all these muscles whether it is tight or loose. Okay, then we will enter into the PT management. So PT management here, after the assessment, either they will be going for a routine antenatal class or they will be coming to you only for their problem. So if they are coming only to their problem, then you can treat that and you can send them back. If they are coming for a routine class, then we have something called antenatal class. So we have to teach them the antenatal class, so that we will see in the next class. So in the routine PT management, whenever they are coming to you, first thing is their posture will definitely get affected, so you have to do a postural correction. So we cannot just do the postural correction. You have to strengthen the muscle and stretch the tighten muscle. Then only they will be able to maintain the normal posture. Okay, so that is very very important. So strengthen all the weakened muscle, stretch all the tightened muscle. So stretching, you have to do a self stretching. There is manual self stretching rather than a passive stretching. Then exercises to improve the proprioception. Because of the joint laxity, the sensation, the proprioception sensation will be reduced. So you need to increase the sensation. You can use the sensory re-education techniques that will be helping you to improve the proprioception sensation. Okay, then next you have to teach them the positioning, ROM exercises to maintain the muscle weakness and muscle tightness, relaxation, then perineal massage in case if they need it. Okay, then so regarding postural correction, you should teach them how to sit, how to stand, and how to bend down. So how to sit is they have to sit in such a height that the leg is in 90 degrees to the floor. The thigh should be completely supported and it should be horizontal to the sitting surface. And the popliteal fossa should not hit over the chair. It should be little bit outside. Then the feet should be flat on the floor with a normal stable base of support. Okay, so the weight should be evenly distributed to both the buttock. So when they are sitting, they have to sit on the ischial tuberosity. So both sides have to be evenly distributed. Okay, so this is very very important. Then the trunk should be maintaining the normal curvature. I'll show you the videos for all these things. Okay, standing again, they should stand in such a way that 1 feet apart. The knee should be the foot should be equally transmitting the body weight. The knee should not go for hyperextension. It has to be in a normal neutral position. The shoulder should be relaxed and it should not be retracted or elevated. It should be relaxed. The arms have to held loosely at the side, and again spine should be having a normal curvature, and head should be in line with the trunk. Okay, lying again, you know how to make them to lie. In supine lying, you have to give them a pillow support under the knee so that the pelvic curvature is maintained properly. Then the pillow have to be given in the under the scapula, not under the neck. So that one is like this one is a normal one which you have already learned in your exercise therapy. Okay, then you have to teach them how to lie down in side lying, prone lying. Mostly prone lying we will not be able to do. Only side lying you can teach them. Okay. Then so how to do kneeling? So kneeling is like you have to you can avoid kneeling for a very long time, but still they can go for a kneeling. So most of the time this kneeling you will be using for doing some activities or exercises. Okay. Let me show you some videos to explain how to do the postural correction. This is how to teach sitting posture. Okay.
Pelvic health physiotherapist here at Ecophysiotherapy. Welcome back to the 5th video of our pregnancy series. Today's video is strictly a demonstration of sitting postures for during and after pregnancy, and these can be especially helpful if you're experiencing any lower back pain or pelvic girdle pain or pain around the hips. So what I want to start off with today is showing you the position you should try to avoid, especially ladies in your 3rd trimester. This position you want to try as best as possible to not sit in. So the first position is the cross-legged position. One knee over the other knee. Now I don't know about you, but sometimes I like to also even wrap my leg around my leg a second time. This is even more difficult, especially at 35 weeks. This is not a good position because what it does is it kind of compresses the pelvis and can lead to discomfort. But not only that, usually in the 3rd trimester, the baby's head is turning down in toward the pelvis, and that posture actually takes space away from the baby. And we certainly do not want to motivate the baby to change position. We want the baby face down. So, best to just avoid that position. So instead, you can try some of these positions. If you like to cross your legs, what you can do is you can actually cross at the ankles. So for example, crossing with your feet underneath the chair, perfectly fine. Keeps the pelvis open and you can have the legs crossed. Alternatively, you could sit with your legs straight and crossed at the ankles. You just want to make sure that your knees are sort of pointing outwards. So again, kind of keeping the space in the pelvis open. If that position becomes uncomfortable, you can try the sit up straight position. So that is basically where you come to the edge of the chair, your legs are open, and instead of sort of sitting in a slumped posture, you want to make sure that your chest is up and your shoulders are down. So you're kind of almost trying to pull your shoulders down toward the chair, and you're sitting sort of straight up. If that position becomes tiring or becomes uncomfortable, you could do the sit back with some back support. So you could try using one of these discs. Basically, it allows you to reposition your pelvis and provides your tailbone and your lower back a little bit of cushion. You don't have to. So I'm going to turn sideways. So I do have the cushion, and I'm just going to place it backwards. I'm going to put my back all the way to the back of the chair, and I'm going to allow it to be supported with my legs open. So just showing you from the front, basically in this type of position where there's lots of space for the baby. Lastly, you can try out this position where you put your ankle over your knee. So you're not crossing your leg, you're kind of opening up the pelvis on one side. You may find this position gets uncomfortable after a bit, but you can then alternatively switch legs. So hopefully you found this video helpful. Test out the postures, and we look forward to seeing you on our next video. Thank you.
Do you want to see it again, or we can go to the next video?
Next video, miss.
Hi, I'm Tova Laufer. I work with EMH Physical Therapy, and today I'm going to talk about some suggestions for posture during pregnancy. So as you can see, I'm pregnant, and I'm going to turn to the side so you can see me. But basically, as you grow in this direction, the tendency is to counterbalance the weight by kind of leaning back. And you'll see a lot of pregnant women kind of walking around like this with a super extreme extension in the spine. And how you want to fix this, what you want to do, is start from the feet down and think about marching in place and then finding the center of your foot. So you want to rock back and forth. Make sure you're not too much in the toe and not too much in the heel, but really ground down and find the center of your feet. And the next thing you want to make sure is that your knees are not locked out, but they're nice and loose, not too bent, not too straight, but just kind of somewhere in the middle. And then we get to the pelvis and the hips. You want to make sure that you can tilt forward and back. Find the center as if your pelvis was a bowl. You don't want it to tip forward. You don't want it to tip back. You want it to be centered. So what you can do is kind of almost cup your stomach, lift it as you tilt. Find the center of where you think you're in space, and then let the baby kind of fall back into the bowl that you just created. And then from there, you want to make sure that you're able to relax these muscles here and that you're able to allow this area to settle down and to avoid that extension pattern. Then you want to make sure that the shoulders aren't too far forward and that you're not hunched, because that tends to happen a lot seated. So what you want to do is slightly shrug the shoulders and turn the arms out, and then slowly settle them down, and then let your arms go. And then from there, you want to make sure that the neck isn't pushed too far forward. So you want to kind of settle yourself, almost like you're lifting it and then settling it over your shoulders, and that you're able to kind of gently nod so it's not stuck in that position, and you're able to settle your whole body with the weight centered over your feet. And those are my tips for standing posture during pregnancy.
To get yourself into the right posture, firstly, make sure that your head is in alignment with your body. To do this, your neck should be erect and it should appear as part of your spine. Next, contract your abdominal muscles and pull the buttocks slightly inwards. Make sure that your body weight is equally divided between both the feet. Always keep yourself erect and don't let your shoulders droop forward. Open out your chest and throw the shoulder blades backward and slightly downwards. Whether you're standing or sitting, always make sure that you keep to this erect position.
Education for the prevention or management of back pain in pregnancy. Be adopting good postural habits, which I understand is much easier said than done. I will elaborate more in the next few slides. Avoiding high heels. Keep them to less than 1 inch, and platforms are better than pointed heels as they too can change your already shifted center of gravity, making it easier to lose your balance. Use a heat pack or a hot water bottle or even a warm bath. Heat relaxes the muscles, can be pain relieving. Remember though, never to place a heat pack or a hot water bottle directly onto the skin. Always wrap it in a few layers of a towel and also never place it on your tummy. Keep it on your back. You may leave it on for approximately 20 minutes. General exercises such as pelvic tilts, can be very helpful for those with tight muscles, but also can help to strengthen those with weakened abdominal muscles. So let's go back to our postural habits. Have a look at these two photos. Look familiar? In the photo on the right, we see what we call a poking chin. Over time, this can lead to added mechanical stress to the neck and upper back region. We see that her shoulders are also fairly rounded. This can also reduce her ability to take deeper breaths, or may cause her even getting short of breath, as the lungs have less room to expand. The photo on the left depicts a fairly common posture we see if perhaps I'm waiting in a longer queue. She takes more weight on the left leg, thereby putting more strain on the muscles of that side of the body. So what would good standing posture look like? We would have our head pulled up and sitting above our shoulders. Drop your shoulders and pull them slightly back at the shoulder blades. Lift your chest and your ribs. Keep your back upright. Tighten your stomach muscles. Tuck your bum in. Bend your knees slightly. Stand with your feet hip width apart. Now let's have a look at the two photos in sitting. With the lower back unsupported and the weight of the baby, this compresses the lower back, and over time this would lead to back pain. Also, having slid forwards on the chair, the thighs are also unsupported, thus making it unsafe, easier to slide off the chair. On the left, that poking chin is still visible. Shoulders are rounded, and the feet are off the ground and not resting. And depending on your lordosis, without any back support, this can become uncomfortable and achy. So let's see what good sitting posture would look like. An ideal chair is one with good back support for your back, holding the back upright. It should allow support for your thighs, allow your knees to relax at right angles, your feet to rest flat on the floor. You can use a back roll or a small cushion at your lower back, which will help to maintain the natural curve of the lower back when sitting down. The way we bend to lift and pick things up can also affect us. Imagine picking up your laundry basket or reaching for that shopping bag on the floor. Common errors are, for example, the photo on the right, keeping the object too far away from us, especially if it is heavy. Or in the photo on the left, though there is more effort here to bend the knees and keep the object closer, the rounding of the back can lead to unwanted added mechanical stress to the lower back. So how would we pick up something from the floor? What's a good lifting technique? You would want to start by pulling your tummy muscles in. So imagine you draw your belly button in towards your spine. Tuck your buttocks in, tighten your pelvic floor muscles, and keep your spine straight. Step into a half kneel position and bring the weight close to your body. This is especially important if what you're picking up is heavy. Using strong thighs instead of your smaller back muscles and ligaments, push through your legs and stand up. How about when we carry things? In the photo, we see that to compensate for the heavy bags on the left, she bends and leans her body towards the right, putting a stretch on the muscles on the left and compressing those on the right. How should we carry? We would want to distribute your load evenly, decrease the load through several trips, or get someone to help you if you can, or use a backpack type of handbag, and this would help redistribute the load evenly. Should you have any burning questions about taking care of yourself during pregnancy and
Okay, so we give more importance to posture because posture is the one that will be causing a lot of problem. Because of posture only, they will have the muscle pain and they will be having muscle tightness and muscle weakness. So that's why we need to give more importance to posture. Okay, so I think I have one more video regarding that.
From pregnancyexercise.co.nz, welcome to our YouTube channel, and today's video we're going to have a look at your posture during your pregnancy, how to improve your posture and what to do if you've got bad posture. So we've got two gorgeous models with us today. These are our models. We've got Jenna, who is 25 weeks, is that right? You almost 26 weeks, excellent. And we've got Ria, who's 29 weeks tomorrow. Okay, Ria here is on her third pregnancy and we've got Jenna on the second pregnancy. So at the moment they're both trying really hard to have good posture. Okay, but last week was a little bit different when we corrected their posture. So what we want to have a look, good posture during pregnancy. Let's have a look at good posture first and why we should have good posture. Good posture is going to help prevent back pain. It's going to help you connect with your core muscles a lot more efficiently, and it's going to help prevent diastasis recti, which is abdominal muscle separation. So to get perfect posture, what we need to do is where they both are is lining up nice and straight. So we're thinking ear, shoulder, and then we will always want to have the rib cage stacked nicely on top of the hip. So it shouldn't be forward, it should be a nice straight line from the rib cage to the pelvis. Okay, and then we go down hip bone, knee and ankle. So if you think about that straight line coming straight down through the center, that plumb line, they would have great posture. Now let's have a look at some postures that are not correct and where they were. This tends to be a typical pregnancy posture, sway back posture, pushing your abdominal muscles forward. So if this is you, what you need to think about is activating your core muscles correctly and just bringing those hips back easily into position throughout the day so that your ribs become nicely stacked on top of your hip bones. Same for Ria. Ria just wants to make sure that she's not leaning back too much. Okay, and we'll just straighten you up. Actually, Ria just needs to tuck her pelvis underneath her just slightly. So what we want to see is a neutral spine, which is a small lumbar lordosis, not an increased one. If you can both just increase that lumbar lordosis, girls. So stick your bums out as if you've got a duck. Okay, so stick your bum out like Donald Duck. Okay, so we don't want to increase lumbar curve because that's also going to put stress on our spines as well. So just tilt under a little bit, Ria. Chest up. Okay, so we need to correct our posture easily throughout the day, and we can do this with different cues, okay, and different tips. So always remember ribs stacked on top of your pelvis, and generally we'd have boobs in front of your abdominal muscles, but during pregnancy this is not going to happen because as your bump grows, okay, so we can't really use that cue. So there you go, that's going to help to improve your posture. Continually check that you're not leaning too far back, have your knees slightly soft. Okay, so if you need any more information, please visit our website, pregnancyexercise.co.nz, and we have more tips.
Okay, so I hope you got some idea about the posture correction. So next we will go to stretching.
and it has really helped me to combat some of those pregnancy.
Actually,
Hey
in this
mamas,
video,
it's Haley from
they will be showing you the common stretches they are supposed to do. Okay.
Let's Mama, and today I'm going to be showing you guys my pregnancy stretching routine. I do this every night, and it has really helped me to combat some of those pregnancy symptoms that I start to feel later in pregnancy, especially. But this is something that I've kind of designed that is safe for all trimesters, and hopefully this will help you guys with some pregnancy symptoms you might be feeling as well. This has helped me with insomnia, back pain, sciatica, restless leg syndrome, and general aches and pains, I guess, as you start to get bigger and your baby grows. So hopefully this is something that you can find helpful to kind of combat those symptoms. I do this every night after my bath, and it has really helped me to especially combat my insomnia at night and just relax and kind of help the day just melt away. So we're going to go ahead and get started. This is a follow along type of video, so feel free to follow along as I'm stretching. If you are feeling like a particular stretch is really helping you, or it's something that you are feeling is really tight and you'd like to work on more, feel free to pause and really kind of melt into that stretch further. It's not really something that I like to just say count to 15 for every stretch, because we have different tension, we carry tension in different parts of our body worse than others. So really tailor this to your specific body, what's feeling good to you, and hopefully it will help you. So let's go ahead and get started. If you want to just start the video, we're going to just start crisscross with our legs. Make sure we're on top of our sit bones and not slouching back like this. We really want to, especially as we're late in pregnancy, like I am, I'm 38 weeks, we want to encourage baby to descend, obviously. So if you want, you can actually kind of grab back there to help you kind of sit really on top of your pelvis and not be closed off at all. Think really tall, think shoulders nice and straight and not slouched over at all. And then we're going to start with just some calming breaths. So we're going to do in the nose, out the mouth, in the nose, now we're going to add our arms to this one. So go in the nose as you reach up, and down as you exhale. In the nose, and exhale. Alright, now we're going to do some shoulder shrugs. This will really just kind of help to loosen that upper back. Alright, and then the other way. I know after carrying around a toddler all day, like I do, my upper back can feel really tight because I'm trying to hold him above my belly. So my upper back can really feel tight at the end of the day, so this always feels really good. Okay, so now continuing to stretch up here in our neck and shoulders, we're going to just do a neck stretch. So go ahead and just kind of tilt back and forth. And then we're going to drop the head, ear kind of pulling towards our shoulder while remaining really tall and having good posture. We don't want to be pulling our neck down physically, we just want the weight of our head to kind of help drop down, and we're going to feel that stretch right in here. On the other side. Feel free to light a candle.
Do you have your next class by 4 o'clock? Student, do you have any class at 4 o'clock? Because this video will take another 10 minutes. So do you have time? Or we will stop here.
No, miss.
You have class?
No.
Okay, okay. So if I take 10 minutes, it's okay, right?
Okay, miss.
Should really help you relax at night. Relaxing before you go into labor is actually one of the things that helps our body go into labor the most. Okay. Now that our neck is loosened up, we're going to kind of work on that upper back now, kind of working down a little bit here. So we're going to lace our fingers together and extend them. And this is just going to kind of pull our back, the top of our back forward, and we're going to kind of just rock to each side. I can feel that kind of working out right now. Okay, now go ahead and hold to one side. Remember to keep breathing. And the other side. Okay. Now we're going to go ahead and grab our fingers behind our back and pull our chest forward, shoulders back. You can kind of sway if you like. Like I said, really tailor this to you. Do what feels good to you. You know your body best. You're feeling what's tight in your body right now as we stretch. So really work on a stretch if you're feeling a lot of tension. Okay, so now that we've kind of loosened up here, I want to go ahead and extend both of our legs out. So we're going to just put both legs out in front of us. If you're in first or second trimester, you could have your legs closer together. But if you're further along like me, we need to make room for baby. So we're not trying to go really widespread here, but make sure we're on top of our sit bones, just wide enough to make room for baby. And we're gonna go ahead and do some calf stretches. I know my calves get super tight during pregnancy, so we're gonna go ahead and just think about pulling our whole leg, top of our leg, down our legs and down and out our toes. So point those down to the ground. And then we're gonna extend our feet up and point them towards the sky. This is when I feel the most tension in my calf. This is where I like to work on my stretch the most because I feel a lot of tension here. Make sure to keep breathing. And like I said, I'm not going to hold each stretch for 30 seconds like I might at night when I'm actually stretching because I don't want the video to be super long. And that way you can tailor your stretches to whatever you're feeling is most tight. And up to the sky. And you might feel that in the top of your thighs here too as you're pointing. If you're kind of feeling like this is a good stretch and you want to work this one a little bit more, you even can lean forward a little bit without hunching. Keep good posture, but kind of lean into the stretch a little bit more. And then point one more time. Pulling this all forward can really help with sciatica too, so if that is something that you struggle with, this can be helpful. It may feel really good to you. Okay, now go ahead and just bring one leg in. We're going to keep one leg out, and we're just going to reach for our toes. We don't want to be leaning over like this in order to get a good stretch because that's putting undue stress on our back. So we want to make sure we have good posture and we're leaning fully forward like this. So don't try to grab further down or reach for your toes even more if you have to compromise your back. Always good posture first, but then reach from where you can and hold. And then if the tension does start to melt away, you can always go deeper into the stretch as you stretch it out. A lot of these stretches look a lot different for us who are further along than maybe if we weren't pregnant. I know they do for me. And then we're going to switch legs. I'll go ahead and bring this one in, and the other leg goes out, and same thing. This is a great stretching routine because you don't need any equipment. It's something that you can do throughout the day if you want. You can really tailor it to whatever you're needing and whatever pregnancy symptoms you might have that you need relief from. Alright, so now both legs out, making sure we still have that good posture, and we're just gonna do a middle stretch. So go ahead and just lean forward and stop wherever you can. I know if you're further along, you might not be able to lean very far forward, and that's totally fine. We're just gonna kind of stretch our back a little bit and our inner thigh as well. Also, I know I said you need no equipment, and I have a yoga mat, but this is obviously something you could do easily on your floor. I just like my yoga mat, so I'll put the link below if you're interested. It's helpful because I have a dog, and I always like to get off the carpet because I don't vacuum probably as much as I should, especially lately. So my yoga mat is really nice when I'm doing stretches or my workouts. Okay. Alright, now we're going to bring both legs in and do the butterfly stretch. So we're going to bring both of our feet flat together. If you want, you can even scooch up a little bit more as long as we're still sitting on those sit bones. And then we're just going to try to release our hips, our hip flexors, and encourage our knees to kind of be pulled down to the floor. Try to take deep calming breaths throughout your stretching. And as you exhale, you can go further into the stretch. If you want, you can even sway a little bit. I know sometimes rocking feels good. It does to me at least. Okay, so this next stretch we're going to do, we're going to go ahead and put one leg slightly bent, and then we're going to go ahead and grab our other leg and put that kind of right above our knee, our ankle, sitting kind of on top of our lower thigh here. So, and then what we're going to do is use our hands behind us to anchor us and push forward. And then you're going to want this knee to kind of be pushing out this way. And that's going to stretch this hip back here and really help with any sciatica. This is really stretching out that piriformis muscle, which is what puts that pressure and where we feel those sharp sciatic pains. So if you're feeling some sciatica lately, this will be really good for you to do even more frequently than once a day, especially when you're feeling pain. Really tailor this to whatever is feeling good to you. If you are having a lot of pain and it's feeling good, then you can really push into it further and get a better stretch. And remember to breathe. Okay, then we'll go ahead and do the same with the other hip as well. So grab this leg, put that right above this knee, use your hands to anchor you, and then push forward and pulling that knee out so that we get a nice good stretch on that hip. Okay. So that is my pregnancy stretching routine. I hope it's something that you can benefit from as well, no matter where you are in your pregnancy. You can even use this postpartum as you're recovering too. It's just an overall really good stretching routine. And I feel like having a nighttime routine can really help with those kind of pregnancy symptoms that we're all feeling now. But I hope you guys enjoyed the video and take something from it. If you can, be sure to like and subscribe and to send to any other pregnant mamas who might find this helpful. I'd also love to see you in the comments below and hear from you about what pregnancy stretches help you, maybe anything that you're struggling with in your pregnancy or about your labor and delivery. I know if you like and subscribe, our baby girl's birth and delivery video will be coming out hopefully soon if she cooperates. So we'll be making that as soon as she decides to make her big debut.
Okay, so these are the practical parts on posture correction and stitching. So next class we will continue with strengthening, but strengthening we will see along with the antenatal classes. Is that clear? So I will upload the videos and the classes, so you go through it. If you have any doubt, then we can have a discussion. Next week we will try to have at least 2 or 3 classes. Okay, I will check your timetable, and along with that, whenever the ID is free, then I will let you know. Is that clear?
Okay, Miss.
So we will see you on Monday. Thank you.
Thank you, Miss.